Hello guys, welcome back. So previously we discussed the first question of pathomorphology base. So we'll be hanging on to the second question over here. The second question says that, see the patient suffering from thrombophlebitis. Where is the thrombophlebitis? In the deep veins, and he died suddenly. Now what has happened? Autopsy was shown the free lying red friable masses with dim crimped surface in the trunk and bifurcation of the pulmonary aorta. Now what pathological process was revealed by morbid anatomist? Look here, first of all you need to know what is thrombus basically. What is a thrombus? Thrombus is simply a clot. Whatever a clot it can be. It can be a clot which happens because of RBC. It can be a clot because of some fat. It can be a clot because of some air. Okay. For example, if the clot or I can also call it as a mass which is obstructing the blood vessel. For example, this is your blood vessel, right? And within this blood vessel here, if there is some type of mass that develops, right? Some mass. So this mass is called as thromb or thrombus, right? This is called as thromb or thrombus. For example, if this mass detaches from here, okay, if this mass detaches from here and just a second, for example, if this mass detaches from here and if it travels all the way in the blood, you call it as embolism. the so overall you call it as the thrombus has undergone embolism. So I have to call it as thromboembolism. Together what do I call? I call it as thromboembolism. When I tell thromboembolism, it should mean that the thrombus or the clot has been embolized, has been moved to another place, right? And moreover, it is a pretty dangerous condition. Now, why is this a dangerous condition? I'll be telling you in a minute. But anyway, so far what you need to know is thrombus is a clot or a mass, and embolism is the movement of the clot or that mass, right? So in this way, we have different types of clots. Different types of clots. Either it can be a blood clot, okay, either it can be blood clot. Where do you see most commonly? In case of unstable angina. Why I'm telling it is unstable? Because the clot is not stable there. It can detach and go into the coronary arteries and completely block the arteries. That is why called as unstable angina. For example, let us think that if you are giving an injection to the patient, right? If you are infusing some fluids into the patient through IV. Now, in the injection, while the doctors are giving the injection, they take pretty much care that there is no amount of air that is left in the syringe. They drip away some amount of fluid out and then they give the intravenous solution. Now, why is this so? Because if you are not dripping out the fluid out and if you're directly giving the injection, sometimes it might happen like this, that within the syringe you have got air in it, and if you're not taking the air out, if you're sending it into the vein, what will happen? Within your blood vessels there will be a lot of air bubbles, and these air bubbles can cause death. Now how does these air bubbles can cause death? I'll be telling you everything in a minute, but for now what you need to know is, so even air also can form a clot, right? Basically through IV route. And third important thing is, for example, let us think this is the bone, right? Of course, surrounding the bone you have got periosteal fat. This is the periosteal fat. And another important thing is, near to the bone you have got blood vessels also to supply the muscles and all. For example, let us think there has been a fracture. Okay, let us think there has been a fracture here. Now, when there is such fracture here, what will happen? There might be chances that the blood vessel also might rupture. So the periosteal fat can easily enter into the blood vessel and cause, what does it cause? It will cause the blockage here inside. So I have to call this thrombus as fat thrombus. So even you also have got fat thrombus, right? So most commonly, how does you get fat into your blood vessels? Because of how does the fat obstruct the blood vessels? In what cases? Most commonly it occurs in bone crust injuries. In the question, if they tell, for example, in the question, if they tell you that a patient was having mild fever and we were giving him some solutions, after some time the patient died, it might be because of air embolism. If in the question, if it also tells that a patient had fracture of the femur bone, and it was patient was stable, after some time the patient died, what might be the cause? When there is bone fractures, of course the fat will enter into the blood vessels. By rupturing the blood vessels, the fat will enter into the blood vessels and cause fat embolism. Okay, so keep in mind regarding the IV route, if you see in the question, put it as air embolism, and if you see in bone crust injuries, you put it as fat embolism. Now let us enter into the topic. For example, let us take, this is your heart, right? And as all of my students know, from the left atrium we have got aorta, not pulmonary artery. So from the left ventricle you have got aorta, not the pulmonary artery, and from the right ventricle you have got pulmonary artery and not the aorta. And all the way it goes over there, and what does happen? Let me draw it some big. Yeah. Here you have got your lungs, right? These are your lungs over here, and you have got your pulmonary artery that is traveling all the way into the lungs. After that, you have got this pink one, which is a pulmonary vein, which finally drains into your left atrium. By the way, into the right atrium, how is the blood basically drained? Through the inferior vena cava. This is your inferior vena cava, which brings blood from your lower parts of your body. Let us simply draw the leg over here. Right. Hope you understood this. This is your anterior picture, right? Anterior surface of the leg. Now let us think that this inferior vena cava is draining blood from the lower extremities, right? Directly all the way it is draining blood into your right heart, right? Now look what happens. For example, sometimes it might happen like this, that as you can see, this is your vein that is collecting blood from the lower part of your legs, right? Now closely look into the vein when you closely look into the vein, you can notice some important things, that within the vein you have got valves like this. These are called valves. Now sometimes what will happen is these valves might be dysfunctional. So when the valves might be dysfunctional, when these valves are dysfunctional, so what will happen is the blood, whatever is here, which basically enters into your right atrium, as these valves are dysfunctional, can the blood be pumped into the right atrium? No. So what will happen? The blood stays here. So the blood stays here, stays here, and finally what will happen? It forms a clot over here, right? It forms a clot. Now by chance, sometimes it might also happen like this, that this clot can break here and this clot can ascend up. It means this clot which is formed here is called as a thrombus, and as this clot is going up like this is called as embolism. So there is thromboembolism, right? So this thrombus is embolizing into your right atrium. From here the thrombus enters into your right ventricle. From here the thrombus passes into your pulmonary aorta. Now from here the thrombus enters into your pulmonary capillaries. Of course pulmonary artery is a big, right? But pulmonary capillaries are very small and very small. We also call it as medium and small sized vessels. These pulmonary capillaries are small sized vessels, right? So when there is obstruction by a thromb, what will happen? Can the oxygen be delivered into the lungs? Can the carbon dioxide be exhaled out through the lungs? No. So there is no carbon dioxide expiration. At the same time, can oxygen enter into the lungs? No. There can be no oxygen inhalation, right? So carbon dioxide cannot be expired out and oxygen cannot be inhaled inside. So in this case, the patient, of course, he will have sudden onset of chest pain. He might have sudden onset of shortness of breath. So patient might have sudden shortness of breath, SOB, in the sense sudden shortness of breath. So obviously patient will have hypoxia. So when patient will have hypoxia, at the end he'll die. So die, it is a rude word, let me write it as death. We are doctors, right? So the patient will die. I mean, there is a death of the patient. So there is some clot somewhere in the vessels. And why this clot has developed? This clot has developed because these valves which are here, these valves are non-functional. So when these valves are not all the valves, only some valves are non-functional. So when some of the valves are non-functional, so that part of the valve which is non-functional, there the thrombus develops, the clot develops. So after developing, what will happen is there might be some, of course, patient will have pain in the legs. When there is a clot within the leg, obviously the blood can't be perfused very good into the legs. So in this condition, patient will have pain in the legs. So this condition, there is a thrombus in the deep veins of your legs. So you call it as deep vein thrombosis. So because of this deep vein thrombosis, patient is having pulmonary embolism. So this condition where the thrombus has embolized all the way and reached the lungs, this condition is called as pulmonary embolism. So most common cause, let me write here, pulmonary embolism. So if I ask you what is the most common cause of pulmonary embolism or PE, is nothing but your deep vein thrombosis. Deep vein thrombosis is the most common cause of pulmonary embolism. Okay, you see here these, let me highlight it. You can see in this picture over here that these are the valves over here. You see, these are the valves, and these valves are shunting the blood upwards. For example, you see here the valves are not functional, the valves are disfigured here. So when the valves are disfigured, can the blood ascend up? No. In fact, the blood stays here and forms clots. You see these red color things over here? These are the clots that are formed. Of course, the patient will have swelling of the leg. As you can see here, if I'm not if I'm not sure that you can exactly figure it out, you see this part and look at this part. So there is a swelling here, so most probably patient might be having DVT here. So if you're not treating the patient who is having DVT, in the long run, definitely the patient, one or the other day, he will have his clot embolized to the lungs and cause PE. So if the patient is having pulmonary embolism, within 10 to 20 minutes, the patient will die. So now look at the question. Patient was suffering from thrombophlebitis of the deep veins. Suddenly he died. Autopsy has shown free-lying red friable masses with dim crimped surface. Now don't bother about all this terminology. Overall understand the concept. In the trunk. What trunk? In the pulmonary trunk. And bifurcation of the pulmonary artery. Right? So what pathological process revealed? Of course, patient had thromboembolism. Clear? Not thrombosis. Thrombosis is the formation of clot. What will happen if the clot is formed here? Nothing is going to happen. But if the clot detaches here and then it ascends up, then something is going to happen. Something strange. So this is not an answer. Tissue embolism, impossible. Embolism with a foreign body, How can embolism happen with a foreign body? Did the patient, even if you ingest, the foreign body will enter into your stomach, not into your deep veins? This is also not a correct answer. Fat embolism, I told you, fat embolism happens only when there are fractures. There are fractures. Did the patient complain of any fractures? No. Why? Because the patient is already dead. How can he complain of fractures? So at anyways, even in the autopsy, there were no fractures that are found on the patient, right? So hope you understood this question, right? So thank you for watching. Please don't forget to share my channel and subscribe my channel. So in the next class, we'll be discussing the question number 3. So till then, take care.